Well, thank you very much. It's a great pleasure to be here again. And indeed, I was asked, did I want to repeat my lectures about health economics and social capital? And I said, well, actually, it'd be more interesting to change the topic a bit. And so my topic is going to be all about using economic evaluation or cost effectiveness evidence to inform healthcare decision making. It's a topic that's really, shall we say, close to my heart. I'm heavily involved with several organisations. Thank you. Several organisations in England which are in the health sector and use economic information. Most notably, there's a body called NICE, or National Institute for Health and Care Excellence. And this body, I'll be talking about it in more detail later, but it makes important decisions for the National Health Service in England regarding which technologies will be available for patients and which will not be. But I've been involved with that organisation since about 2003. So you can see I love it. Not the organisation, I love the use of economic information to try and take better decisions. If I didn't like it or support it, I wouldn't still be doing it after all these years. I've also been a member of an organisation called SABTO, the Safety of Blood, Tissues and Organs. I did that for about 8 years. And that committee was responsible for formulating policy with respect to the safety of blood and blood products and tissues and organs for transplant. And I've also been involved in other organisations. Another one I'll be talking a little bit about later this week is the Joint Committee on Vaccination Immunisations, or JCVI. And again, they utilise health economic information to try and assist them in taking decisions regarding which programmes of immunisation to introduce or which not to introduce. Now, this picture here was just around the corner from my office. I was walking past one day and I spotted it. And I thought it summed up the essence of economic evidence and decision making for healthcare. We're trying to hold on to our money. Healthcare is expensive. There's no shortage of things we could be putting money into in the health sector. Lots and lots of new developments, which is good news. There's also old things that work. That's good. But while we want to spend, we don't want to spend too much. There's other things we care about in life. So this character is trying to hang on to his heart and his health at the same time, firmly grasping the money. And he's being torn. Actually, literally, he's missing a leg, I think, but I think that was vandals or something, rather than the health sector leading to it. Well, I'm just about to give you an overview of what these 6 lectures will cover. In this first lecture, I'm going to look at the underlying approach of using cost-effectiveness information to help decision making, and I'm going to point out a number of the challenges that arise. Then in the first the lecture this afternoon, I'm going to introduce you to a particular issue in economic evaluation, and that is the issue of being able to model the future, what's going to happen to the patients as a result, particularly of interventions. Then tomorrow morning, I'll move on to another important topic, and that is the way we value the time patients spend in different health states. Because many healthcare interventions work by moving patients into a better health state than they otherwise would be in. That's how they work. And so what we're trying to do is compare the time patients will spend in different health states given current treatments or current programs. We want to compare that with the time they'll spend in different health states with a new program or new treatment. And it's not just enough to know how long patients will live in different health states. We need some information on how good or bad that health state is. And so that will be the topic of tomorrow morning's lecture. And the dominant approach in this area is to calculate something called QALYs, or Quality Adjusted Life Years. The principle there is that while we're very interested in whether patients live or die, we're also very interested in, when they survive, the nature of their survival. What sort of, broadly speaking, quality of life do they expect to enjoy? And the QALY, Quality Adjusted Life Year, is an attempt to combine those two dimensions: changes in survival and changes in the health state that they survive in. Tomorrow afternoon's lecture is going to look at alternatives to the QALY, because QALYs, while very useful, are readily criticised and have their own limitations. And I'll look at the two main approaches that have been suggested as an alternative to the QALY. One is to use money to value health outcomes, and the other is to look at life satisfaction or well-being. And there's an area of health economics and broader economics research that's been developed in recent years called happiness research. And it's based on the idea, could we not just measure how happy people are, and then we measure the benefit of an intervention by how much we increase happiness? So I'll introduce you to that approach. But I stress the dominant approach, thank you very much, is the calculation of QALYs. Here goes. All cross our fingers. Yay. Thank you. It's great having assistants. Yeah, so this is just a quick run through. These are the lectures. So, as I say, I'll introduce this dominant approach of looking at the cost per QALY gained. And in order to calculate our QALYs, we have to be able to model the time individuals spend in different health states. And then we need to be able to value that time that they're spending in different health states. I'll look at alternative approaches to valuing health outcomes in Lecture 4. And in Lecture 5, I'm going to keep with economic evaluation, but move it more into the area of public health interventions and look at particular issues raised when we're looking at public health interventions, as opposed to perhaps interventions such as many drug treatments which are directed at the individual. And then I'm going to finish, it's Friday afternoon, I'm going to finish by standing back from all of the detail. There'll be a lot of detail in the next few lectures, but in the last lecture, stand back from the detail and start to look at the broad advantages, but also the limitations of the economic approach, because it's particularly important that you're aware of both. Economic evaluation is becoming more and more important in a wider range of countries around the world. Clearly, there are groups of decision makers who see advantages in bringing economics and economic evaluation into account when we are making decisions regarding our healthcare priorities. But at the same time, all methods are limited, and there are many challenges in considering economic information in our decision making. And I want to bring out the challenges as well as the strengths. And so that's where we'll get to. And I hope you survive. Well, I hope my voice survives. I don't quite know why my voice is so weak these days, but I had a health problem last November, and one of the consequences is I used to be able to not quite fill a football stadium with my voice, but I used to feel I could project, like an actor. But now my voice has lost its power. But it's a nice small room, so I hope it won't be too much of a problem. If at any point I get too faint, just, encourage me to speak louder. Yeah. Also, I should say, excuse me, throughout, I'm very happy to take comments, questions. We can have discussions around different points. I'm perfectly happy to repeat things or restate things. Okay? So just feel free. I know it can sometimes feel a bit sort of, you think, I don't get this. Maybe everybody else understands it, and I don't want to own up. I don't want to say. But if you have a problem, be aware others probably also have a problem.